Hey everyone, it's Dr. Jewels, and we want to spend some time with you and talk about the importance of oral health. So what is oral health? Well, in broad terms, essentially, we feel oral health is achieved in your pet when their mouth is disease and pain-free. So what can cause disease and pain in a dog or cat's mouth? Periodontal disease. This is one of the most common diseases that we diagnose at the Peotone Animal Hospital. And so I'm going to walk you through, in general terms, what periodontal disease is and how we can kind of help and prevent it. Okay, so we're going to zoom in on this diagram here and get it to a point where you can kind of see the pathology going on underneath the gums. Okay, so we're looking at a dog's mouth, all right, and there's a couple things that we're seeing here. So you can see the crown surface of the tooth here, and then this is the gingival margin, the gum margin, and then this is all in the bone, right? These are the roots here that we can't see with the naked eye, right? So what we're showing here, periodontal disease is essentially the buildup of plaque and tartar. So when we have this at a certain angle, you can actually see the color of plaque and tartar that kind of, sometimes it's that tannish, gray, green, brown, can be a lot of different colors accumulating on the crown surface of the tooth. And what that is essentially is it's bacteria. Sometimes it's mineralized if it progresses to calculus. But in general, what happens with periodontal disease is that bacteria starts to thrive and then creates an infection underneath the gum line. So you're seeing some of the results of that. So bone loss or bone destruction. So the bone that's surrounding the tooth roots starts to crawl up. We lose the integrity, the bone integrity surrounding those tooth roots. The gums can recede, okay? The gums pull back from that tooth. Swollen, painful gums or gingivitis, okay? And you can see kind of that green speckle here. That's just bacteria that's getting underneath the gums. It's painful, okay? Bad breath or halitosis. It's not normal for a dog or a cat to have bad breath. A lot of people think as they get older that they develop bad breath. That's not something that you should think is normal, all right? So periodontal disease is important. It causes pain, discomfort, and so we need to find ways at home that we can address it, okay? It's also important to note that patients with severe periodontal disease have had documented damage to the liver, kidneys, and heart. The head is attached to the rest of the body, right? So if there's disease in one part, it can spread to another part of the body. So it's important to note that that bacteria that's underneath the gums can spread, and it's been documented to the liver, heart, and kidneys. Okay, so how do we establish a home care plan? We're going to have another video that goes through some options that we can help you to establish a dental care plan. But it's important to note that we do not recommend starting any type of dental care plan at home until your pet's mouth has been evaluated by a veterinarian. And this is because if there's already pathology in the mouth, some type of pain, whether it's a fractured tooth, whether it's periodontal disease, gum inflammation, or gingivitis, gum infection, your pet will very likely strongly resist toothbrushing or certain types of chews, or they may downright refuse it, and that's the last thing that we want, okay? So it's very important that we have the mouth checked out before we establish a dental care plan.